Hey everybody, it's Kathy Mack coming to you with more information on how my bilateral knee replacement surgery is going. I had a hard time Friday night. A lot of swelling due to the physical therapy that I had did. And I also put an ice machine that had the massager on it. My skin was not used to that. Wasn't used to receiving the massage, and it felt wonderful. And then it started getting painful after a certain amount of time. So that was my fault. Probably left the machine on too long, and it made it uncomfortable for me. But that started my day. That was my morning. I did each leg and took my medication, and then I had physical therapy. Big mistake. My fault. And I'm not a professional. I'm not a doctor. This is just my story. This is my journey on having my bilateral knee replacement done. And so after receiving physical therapy, the therapist was wonderful, did a great job, worked well with me. By the time we finished, he had to assist me back into bed. I was in a lot of pain. And so I think my evening kind of just snowballed from there. And I wind up going to the ER, having a lot of swelling. I was icing, elevating, medicating, and it still wasn't enough. So didn't want to call 911. And so I had to endure the ride of getting in the car, going to the hospital, and them assisting me. But the hospital was great. They took me right in. They saw how much pain I was in and took me right to the back ahead of some other few patients and ahead of other patients. And I'm sorry they took me to the back before them, but I was in a lot of pain. My pain was probably a 12. And if I say it's a 10, it's really a 12. So sometimes we have to be honest with those we're working with, honest with ourselves on how much pain we are really enduring. I try not to complain a lot. I try not to ask for a lot. So I try to do everything myself, but we can't. We need the help. So after getting to the hospital and being admitted, well, not admitted, excuse me, being taken back to the ER in a room, the doctor, they started right away. Doctor started giving the orders of what she wanted done for me. Long story short, medication, IV, x-rays, well, ultrasound. And after the results, everything came back clear. I had just really, I guess my knees were inflamed, and where the medication had calmed everything down and allowed me to rest, allowed my body to start resting so it could get back in recovery mode, and gave me another dosage of medication for the ride home, and which definitely I needed to have. I definitely needed to have the medication for the ride home. And once we got back home, I was able to rest and relax, and took medication once I got home as they instructed. And I was able to get a decent amount of sleep comfortably. And that was it for, it was actually Friday night. My surgery was on Monday, and that was Friday night. So went well. Started off well, ended kind of on a bad note, but really, the final ending was wonderful. And so today is Saturday. I'm off. Today's Sunday. And Saturday was a good day. I was able to just rest and do exercises as I needed to do, but I didn't overdo it. I made sure that I iced, medicated, rested, and try to think of the other one I can't think. But exercised, iced, medicated, and rested. So yeah, I made sure that I did that and just took it easier Saturday than I had done on Friday. So just want to let you guys know that I'm doing well. Actually gonna insert some pictures and let you guys see, how my progress is coming along. I don't have much of an appetite. I've been eating salad, tuna, or just salads, vegetable salads. I know I need to get a little more protein in, so I am drinking some Boost drinks and just drinking a lot of water. So that's about it, you guys. I hope that this is going to help someone. Everyone has to make their own decision if they want to have one knee done at a time or both knees done at a time. And there are not many videos out there that of those who have done both knees at the same time. I'm really on a journey right now. I'm going to start going over my story since Anthony passed, and my husband is Anthony. Anthony passed in 2022, and I've kind of been on a recovery journey for myself, and I have a goal, and I really want to share that goal with you guys. So these are things that I'm going to need to do in order for me to get to the goal that I want to achieve. So I'm going to take you guys along. Please come along on my journey. I'll try not to talk too much, okay? But yeah, I want to give you little hints here and there of what my plans are for my future. So everyone have a good day, have a good evening, whatever time of the day it is when you're watching this video. Enjoy. Enjoy, enjoy, enjoy. Have a wonderful day, and I'll talk to you again soon.